This topic is about the application of sequential compression devices, SCDs, and compression stockings. Before we illustrate how to apply these items, let's talk about why we use them. Decreased blood flow to the heart causes venous stasis, which puts the client at risk for thromboembolisms. You can see in the image here a deep vein thrombosis. Some potential causes for decreased blood flow are immobility, like when a client is on bed rest, polycythemia, smoking, diabetes mellitus, and irregular heart rhythms such as atrial fibrillation. Applying adequate compression prevents the pooling of blood in the extremities by improving the blood flow through the veins back to the heart. Some indications for SCDs and compression stockings include deep venous thrombosis prevention, as seen in the image here, post-operative prophylaxis for immobility, stroke, venous insufficiency to return the venous blood back to the heart, and varicose veins. An SCD machine is a device that pumps air through a sleeve to an extremity, either intermittently or sequentially. The sleeve is divided into compartments which alternate in filling with air, allowing compression to the ankle, calf, or thigh. The air pressure mimics the muscle pumping action of the legs and enhances venous blood flow back to the heart. This creates a constant flow of blood to the heart even when the client is stationary. SCDs can be used in a couple different modes. During asymmetric compression, the device inflates only one area at a time. For example, the SCD will alternate from compressing the lower right leg to the upper right leg, and then switch to the left side. During circumferential compression, the device allows even compression to the entire area, such as compressing the entire right leg and then alternating to compressing the entire left leg. And lastly, during graduated compression, the device will inflate the sleeve gradually, increasing the pressure as it extends up the extremity and then gradually releasing the pressure, allowing relaxation. There are also two types of compression stockings, graduated and anti-embolism. With both stockings, constant pressure is given throughout the extremity in varying degrees. With graduated compression stockings, 20 to 40 millimeters of mercury of pressure are applied gradually, increasing with the most pressure at the furthest point from the heart. With anti-embolism stockings, only 12 to 20 millimeters of mercury of pressure is applied, again with the greatest amount of pressure starting at the furthest point from the heart. Before applying SCDs, it's important to observe the skin for irritation or open lesions, as these can restrict proper wound healing and become uncomfortable for the client. You want to make sure proper placement is found by aligning the sleeve opening with the back of the knee. This allows the client to still move around and have proper flexion and extension of the joint. Wrap the extremity securely in the sleeve, allowing 2 finger width between the sleeve and the skin to allow for proper airflow. Attach the tubing from the sleeve to the SCD unit and don't forget to power on the device. A green light indicates that the machine is on. It's important to observe one full cycle to make sure each compartment fills completely. SCDs should be worn at times while the client is stationary, so while in a bed or up in a chair, but remember to remove the device before ambulating. Finding the right size compression stocking is just as important as wearing them. If stockings are not fitted or worn correctly, venous return could be obstructed rather than enhanced. So let's talk about getting the proper fitting. For knee-length stockings, measure from the heel to the back of the knee. Also measure the circumference of the widest part of the calf. You can see that on the left side of the image here. For thigh-length stockings, measure the length from the heel to the bottom of the gluteal fold, as well as the circumference of the widest part of the calf and the widest part of the thigh, like shown on the right side of the image. Applying compression stockings before ambulation maximizes the compression effects and promotes venous return. Applying compression stockings can be difficult, but with proper technique and help from a second person, application becomes easier and increases client compliance. To do so, position the client supine, like in a bed, or you can have them sitting in a chair facing you. Grab the inside heel of the stocking, like shown in Step 1 illustration, by placing your arm through the top opening and down inside the stocking. Pull the stocking out and through so the stocking is inverted, leaving the end folded in on itself, as seen in Step 2. Ask the client to point the toes and apply the stocking starting at the folded inverted end, as seen in Step 3. Pull the stocking up towards the upper legs, pulling the stocking back out from the inverted position as seen in Step 4. Inspect for a smooth stocking. Make sure there are no wrinkles, gatherings, or rolls of this stocking against the client's extremities. Client teaching is beneficial for compliance in using SCDs and stockings. It's important to teach the client to report calf tenderness because this is a symptom of a DVT. Monitor for skin breakdown or irritation before and after application. Ensure the stockings are free of folds and wrinkles because this can also lead to skin breakdown. Avoid rolling or gathering the stocking after application. The increased pressure underneath a roll or a gather can become a tourniquet and obstruct blood flow. Instruct the client to avoid crossing the legs. This increases pressure at the touching points and decreases venous return. You can encourage the client to elevate their legs when sitting because this stimulates blood flow back to the heart.